Do you ever feel anxious about what the heck you should bring up in therapy? I am Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist, as well as an ASEC-certified sex therapist. Happy Thursday and happy Therapy Thursday, where we are going to spin the therapy wheel to talk about some of the topics that I want to talk about that come up quite a bit in therapy with some of my patients, but also things that I just love to talk about. So let's spin that wheel. Oh, we're in the red. Ooh, slaying shame. This is so well prompted. I'm having my husband go through Buffy the Vampire Slayer for the first time, and I have lots of thoughts doing that rewatch. Let's talk about shame. Shame is an emotion, a really intense emotion that we often feel when there is a perceived violation of a norm or a norme. Cultural norms, religious norms, social norms, all of the norms, where we'll feel a certain degree of embarrassment or shame or ashamedness in response to how we think, feel, act, respond to different things, and that can be a really big deterrent to our behavior moving forward and play a huge role in increasing the likelihood that we're going to feel other emotions like guilt and blame, depression, anger towards ourselves, whole variety of different things. So whenever we talk about slaying shame, I do feel a little bit like Buffy of how do we eliminate it? So there are certain emotions in therapy we don't want to eliminate. Like, I need you a little anxious. I need you to experience sadness or anxiety or anger. Shame don't do shit. All I want to do is get rid of the shame. So if you notice yourself experiencing negative thoughts about who you are and feeling disgusted with yourself or embarrassed about who you are and that internal shame because of the very human that you are, probably something you would like to bring up in therapy. Shame can be a huge deterrent for your life. It can really make your life really small because it's creating what's called a conditional life. A conditional life is essentially this idea that you can only exist in your life and in your world under particular circumstances, which creates a lot of rigidity. So for example, I work a lot with individuals who experience sexual shame, shame about how their bodies function, what it looks like, what the smells are, the wibbly wobblies that happen during a sexual encounter. And let me tell you, the biggest cock block of them all is shame. So whenever you're thinking about bringing something up in therapy, you want to ask yourself, do I experience embarrassment about this topic? Do I feel ashamed to bring this up? Am I a little apprehensive? Why or why not? And it really allows us to look at the role of shame that it's playing on your very existence. Because if shame actually worked in engaging in behavior modification, it probably would have already. Shame can create a lot of negative beliefs about yourself and really make your world super duper small. So this week in therapy, why don't you bring up some shame so that we can undo that really unhelpful programming? What are some of the topics that you've noticed going on in your own therapy that if you feel comfortable talking about it, feel free to put it in the comments down below. If you are a clinician, what are some of the topics you're noticing coming up in the work with your patients? Feel free to put those down in the comments below. And I will see you next Thursday for another episode of Therapy Thursday. See you then.